Welcome to Project First Line. Sepsis. Recognizing the signs of sepsis in healthcare settings. In this presentation, we'll discuss what sepsis is, how germs spread and make people sick, recognizing the risk for sepsis, antimicrobial stewardship and sepsis, getting ahead of sepsis, surviving sepsis, and the core elements of a sepsis program. The objectives include: know how infections can lead to sepsis, understand the impact of sepsis on the healthcare system, identify populations at risk for developing sepsis, recognize the signs and symptoms of sepsis, understanding the importance of preventing sepsis and initiating early treatment, describe the role of antimicrobial stewardship in sepsis, and identify the key elements of a successful sepsis program. What is sepsis? Sepsis occurs when an infection overwhelms the body's immune responses. The immune system is therefore no longer able to fight off the infection, but rather it turns on itself. The inflammatory response damages cells and organs in the body, which disrupts normal body processes. This chain reaction is what leads to sepsis. As shown on the graphic on this slide, sepsis is a process that needs to be interrupted early before it gets too far into the cycle. This is because the damage to the body can lead to long-term health complications, resulting from the tissue damage and organ failure. If it is not stopped and corrected early, sepsis can be fatal. Understanding sepsis. Sepsis is used to describe conditions when the body's normal processes fail as a result of an overwhelming infection. Sepsis is a medical emergency that requires immediate treatment. And, even though sepsis is mostly caused by bacterial infections that can be contagious, sepsis itself is not a contagious illness, but it is a life-threatening one. Before we can understand how to recognize sepsis, we need to first review how germs make people sick and how infections spread. We know that germs are everywhere, in and on our bodies and in the environment. Most germs are not harmful to us, but some can cause illness. In order for germs to make people sick, they need 5 things. Let's look at those first. The 5 elements that are needed for germs to spread and cause infections are reservoirs. Reservoirs are a place where germs live and grow, most commonly the skin, GI system, lungs, and blood. Germs also need a pathway, which is how germs travel. This can be through touch, splashes, or sprays. Germs also need a person to infect. Germs also need to get around the body's defenses or defeat the body's defense mechanisms. And finally, germ survival is the capability for germs to survive in a person to allow an infection to occur. Understanding how germs spread helps us recognize the risk for infections and, in turn, the risk for sepsis. Since sepsis begins from an existing infection, and we know that infections are caused by germs, we need to look at germs in the context of where they live in the body. The 4 reservoirs in the human body that are important for infection control are the skin, the gastrointestinal system, the respiratory system, and blood. Knowing where germs live helps us to understand where there is a risk for them to spread. Recognizing that risk helps us understand the importance of infection control to stopping the spread of germs. How germs spread in healthcare. 4 main pathways. Germs also need a way to travel from where they live in order to cause an infection that could lead to sepsis. In healthcare, there are 4 main pathways that germs use to spread. Germs spread through touch, which involves the skin as a reservoir. Germs also spread when we breathe them in or through splashes and sprays of bodily fluid that can get into our eyes, nose, mouth, or breaks in the skin. The four common pathway in healthcare is through clinical care tasks that bypass or break the body's defenses. A common procedure to think about is the insertion of IVs or administering injectable medications. The break in skin provides germs with a pathway to enter the body and potentially cause an infection. Knowing where germs live and how they spread helps you recognize risk. When we know where germs live and how they spread, we can develop a better understanding of how infection control practices can be applied to any of the five elements to stop germs from spreading and causing infections. This in turn helps us reduce the risk for sepsis. Remember, understanding the five elements helps us to recognize the risk for germs to spread and cause infections, thus allowing us the opportunity to act early. Thinking back on the four reservoirs that germs live in, can you name some of the common types of infections that could lead to sepsis? Take a moment here to come up with some answers, and then continue to the next slide when ready. Common types of infections that can cause sepsis. Since sepsis usually results from infections that overwhelm the system, and we know that infections are the result of germs entering the body, we can then identify some of the common infections that lead to sepsis. Remember, any type of infection can cause sepsis, but the most common ones are lung infections, UTIs or kidney infections, gastrointestinal infections, and skin infections. Sepsis by the numbers. Sepsis is a major concern in healthcare and, in particular, a barrier in infection control. It is the number one cause of death in U.S. hospitals. Sepsis affects 1.7 people annually and causes over 1.3 million hospitalizations of adults over the age of 45. 70% of adults hospitalized with sepsis are adults over the age of 60. Of those hospitalized, over 350,000 die annually. Something to note is that it is a common misconception that sepsis starts in the hospital setting. Statistics show that over 87% of sepsis cases actually begin in the community before the person even goes to a hospital. Unfortunately, in long-term care facilities, long-term care residents are 6 times more likely to present to the hospital with sepsis, with 3/4 of all sepsis deaths being those adults over the age of 65. Why we care about sepsis. Keeping those statistics in mind, let's look at why we should care about sepsis. Sepsis can affect anyone. It affects over 1.7 million people annually, which means one person is diagnosed with sepsis every 20 seconds. As we've seen in the most recent pandemic, viral sepsis is the most common complication of COVID-19, seen in 78% of those hospitalized in the ICU. Unfortunately, 35% of the population have never heard of sepsis. Sepsis also has a big impact on life expectancy. Some survivors of sepsis live with long-term complications, ranging anywhere from cognitive deficits to functional impairments. These impairments can result in a short life expectancy. Additionally, sepsis may also lead to death. According to the Sepsis Alliance, sepsis accounts for over 6% of all hospitalizations and over 35% of all hospital deaths. Sepsis also has a large economic impact that continues to rise. During hospitalization, the treatment and management of sepsis puts a strain of $62 billion annually on the healthcare system and its resources. This is because sepsis commonly arises from preventable and treatable infections. Delayed treatment results in the use of more resources that could be allocated for other medical needs. Additionally, the economic impact to the affected individuals does not stop post-discharge. The long-term complications that some survivors experience require ongoing care and resources, which puts an additional strain to the management of their health and well-being. Now that we have an understanding of what sepsis is, let's look at how to recognize the risks for sepsis. Recognizing sepsis. Just like we recognize risks in our everyday clinical activities while caring for patients, we need to use the same critical thinking processes to recognize the early warning signs for sepsis. To recognize the early warning signs for sepsis, we need to know who is most at risk. Can you think of any groups of people that you encounter every day in your healthcare setting that might be at risk for developing sepsis? We know that sepsis can affect anyone at any time. However, there are certain groups of people that are more at risk. These groups include the elderly, those with immunocompromised systems, those living with chronic medical conditions, those recently hospitalized with a severe illness, those that have recovered from sepsis, and children under the age of 1. Understanding who is most at risk is the first step in developing a better awareness about sepsis and what to look for early recognition and treatment. How do we recognize sepsis? Once we understand who is at high risk for developing sepsis, we then need to identify the signs and symptoms. Because sepsis is not a single condition, but rather a complication of an existing infection, we need to be able to identify the signs and symptoms associated with worsening infections. This is important because sepsis is diagnosed based on a set of signs and symptoms rather than the existing infection itself. Understanding this allows us to develop the necessary awareness needed to achieve early recognition. A simple way to remember the signs and symptoms of sepsis is to follow time. T stands for temperature. Is the temperature high or low? I stands for infection. Are there signs and symptoms of an infection? M stands for mental decline. Is there new confusion, excessive sleepiness, or are they difficult to wake? E stands for extremely ill. Is there severe pain, discomfort, shortness of breath, or racing heart rate? Time is a great and easy way to remember what to look for because we know that early detection is critical for the successful diagnosis and treatment of sepsis. Now that we know what to look for, let's review some of the common signs and symptoms of infection seen in most people. Sepsis can affect different parts of the body and people of all ages. As a result, sepsis symptoms can manifest differently in all of us. However, these are some of the most common signs and symptoms seen in most infections that cause sepsis. Learning how to recognize these symptoms enables us to recognize the risk for sepsis early. When caring for your patients, always be on the lookout for any of the following: an infection that is not getting better, a racing heart rate, feeling very cold or very hot, having a tough time breathing, feeling very sweaty or cold and sticky, being in a lot of pain, or experiencing new confusion. If any of these are present, think, could it be sepsis? And then alert a nurse or doctor immediately. Remember, knowing who is at risk and what those signs look like is not all. We also need to act fast. When you recognize signs of a worsening infection that could be sepsis, immediately alert a provider in order to activate emergency services and prompt treatment. Acting fast is critical, and as the Sepsis Alliance data shows, as many as 80% of sepsis deaths could be prevented with rapid diagnosis and treatment. In addition to this, we also need to continually educate our patients about the signs and symptoms that they may develop with sepsis and how to advocate for prompt treatment. Antimicrobial stewardship and sepsis. As previously discussed, the number one cause of sepsis is bacterial infections, which means that the number one course of treatment are antibiotics. This is why it is important to discuss how antibiotics and antimicrobial stewardship tie into sepsis. Antimicrobial stewardship. How are antimicrobial stewardship and sepsis connected? We may think of antimicrobial stewardship as only reducing the excessive use of antibiotics. However, antimicrobial stewardship programs can play an important role in optimizing the use of antibiotics, leading to better patient outcomes. How can antimicrobial stewardship impact sepsis? With sepsis, we need to act fast. Administering appropriate antibiotics early can reduce morbidity and save lives in serious infections, such as sepsis. After we have results back that can inform how we should treat the infection, it's important to review our initial antibiotic choices. An antibiotic timeout allows us to adjust or stop those initial antibiotics based on the information we've learned about the patient and their infection. Antimicrobial resistance and sepsis. If germs become resistant, they become harder to treat in serious infections such as sepsis. We want to ensure that we have antimicrobial stewardship in order to try to slow antimicrobial resistance. Using antibiotics inappropriately can increase the risk of antimicrobial resistance, making it more challenging to treat patients with sepsis. With effective infection control practices and antimicrobial stewardship, we can work to stop the spread of resistant germs and reduce the need for antibiotics or antifungal medications. Getting ahead of sepsis. So far, we've developed an understanding of what sepsis is, the impact it has, and how to recognize signs early. We can also act fast before sepsis develops. We need to know what to do to help reduce the spread of infections that can cause sepsis. Getting ahead of sepsis. Some of the steps we can take to prevent sepsis from developing include taking care of our health and well-being and that of our patients in order to prevent infections. This can include taking good care of chronic health conditions, getting the recommended vaccines that help prevent some infections, and adhering to prescribed treatment for any infections to promote full recovery. Practicing good hand hygiene and always ensuring that any cuts or wounds are kept clean and covered until they're healed. Knowing the possible signs and symptoms of sepsis in order to prompt early recognition of infections that could lead to sepsis. And last, we always need to act fast when we suspect an infection of sepsis. Remember, sepsis is a medical emergency and requires immediate treatment to prevent long-term complications and/or death. September is Sepsis Awareness Month. Sepsis is a major concern in healthcare, and we need to continue to create awareness in order to help our patients achieve better outcomes. When you're thinking about how to create awareness about sepsis and how to effectively care for your patients, make sure that you know the risks of sepsis, that you can spot the signs and symptoms of infection that could lead to sepsis, and act fast. Just as it is important to learn about sepsis, we also need to talk about life after a sepsis illness. Post-sepsis syndrome. After recovering from a sepsis illness, many survivors experience physical and psychological impairments. These impairments are called post-sepsis syndrome, or PSS. Post-sepsis syndrome occurs in over 50% of sepsis survivors and more commonly in those hospitalized for long durations of time or in intensive care units. Some of the causes of post-sepsis syndrome include blood clots and poor circulation, as well as organ damage to organs such as the heart, lungs, liver, and kidneys. For some, the cause of post-sepsis syndrome is a result of impaired body function, but for others, the cause cannot be explained. Post-sepsis syndrome, just like sepsis, can affect anyone, but older adults are at a higher risk of developing these impairments. A research study by the University of Michigan Health System found that older severe sepsis survivors were at a higher risk for developing long-term cognitive impairment and physical problems than others their age who were treated for other illnesses. One-third of all sepsis survivors, with older adults accounting for more than 40%, have another hospitalization within 3 months of the initial sepsis. This is commonly due to a repeat episode of sepsis or another infection that results from a suppressed or weakened immune system. Research also shows that more than 1/6 of all sepsis survivors experience difficulties with concentration, memory, and decision making, with older adults also being at higher risk to develop additional limitations on activities of daily living. It is therefore important to know that sepsis survivors have a long road to recovery ahead of them. Identifying those individuals at high risk for long-term impairments post-illness is critical to the successful management of sepsis. As we can see from these statistics, sepsis management does not end after discharge from the hospital. This is why it's important for us to also be aware of the signs and symptoms that might manifest after the initial sepsis illness. Post-sepsis syndrome signs and symptoms to look out for include impaired ability with activities of daily living, a decline in cognitive functioning, a change in mental health, as well as reports of ongoing signs of illness. Even after individuals recover from the initial sepsis infection, healthcare providers remain the front line in the management of any long-term impairments and the change in quality of life. Remember, sepsis awareness calls us to be proactive before sepsis occurs, but continue to be proactive even after patients recover from their initial sepsis illness. So far, we've looked at what sepsis is, how to recognize it, and how to get ahead of it. The last thing we're going to look at is what healthcare facilities can do to empower their staff in the management of sepsis. In order to successfully manage sepsis, healthcare facilities need to implement protocols and programs aimed at supporting staff who care for individuals that may be at risk for developing sepsis. The CDC has developed core elements of a sepsis program that can be adapted to any facility type that might be involved in the management of sepsis. We understand that sepsis is complex, and because it comes from an existing infection, treatment plans need to be tailored to each unique presentation. Unfortunately, we have also seen how the burden of sepsis continues to grow while community knowledge remains low. Because of this, there have been many national and global initiatives to improve sepsis identification, management, and outcomes, but more work needs to be done. To aid with sepsis management, the CDC has put together the core elements of a successful sepsis program to optimize the management of sepsis in different types of healthcare facilities. These core elements can be adapted to the capabilities of each facility. Some of the benefits of these core elements include aiding in the recognition of sepsis, facilitating the implementation of evidence-based management of sepsis, supporting the recovery of patients after sepsis, and monitoring the impact of hospital-based interventions to improve care and outcome of sepsis. Getting started. Even though the core elements are adaptable to many facility types, not all facilities may have the capabilities to implement all of the elements. The CDC recommends that before a sepsis program is implemented, the following steps should be addressed. Those include identifying the sepsis program leader or leaders and any co-leaders, securing support from the facility's leadership, conducting a needs analysis to identify regulatory or reporting requirements, screening protocols, and treatment guidelines, and establishing the initial goals for a sepsis program based on the needs analysis. With that in mind, let's review each of the core elements. Sepsis program core elements include hospital leadership commitment. Support from hospital or health system leadership is critical to the success of a sepsis program. A successful program needs engagement from management and staff. With commitment from leadership, the appropriate resources would be allocated to the program and performance improvement would be a priority. Accountability. A successful sepsis program needs leaders who are accountable for its management and outcomes. To be accountable, leaders also need to have effective leadership, management, and communication skills, in addition to clinical expertise in sepsis. Multi-professional expertise. The management of sepsis requires a multidisciplinary approach because sepsis can be caused by many types of infections that require different types of clinical expertise. Therefore, a successful sepsis program also requires the engagement of multidisciplinary partners. Action. A sepsis program aims to improve treatment and outcomes of patients with sepsis. A sepsis program should therefore have structures and processes that facilitate the recognition of sepsis, evidence-based management of sepsis, and long-term recovery from sepsis. Interventions should be monitored and refined to optimize the treatment and outcome goals of the program. Tracking. Tracking of sepsis epidemiology, management, and outcomes is critical for identifying gaps and trends and understanding the impacts of the program's interventions. Facilities need to prioritize what sepsis measures to track and focus on what processes and outcomes are most important to patients. An important measure to consider is special patient populations as well as patient demographics to monitor for disparities in sepsis management and outcomes. Reporting. Reporting of sepsis treatment and outcomes in a clear and transparent manner to relevant staff helps maintain staff engagement, motivates behavior change, and facilitates improvement in the overall management of sepsis. Sepsis reporting should focus on data that is most actionable, meaning data that is timely and focused. Education. A successful program also requires that all healthcare staff have a strong understanding of sepsis as well as their roles in the management of sepsis. Patients, family, and their caregivers should also be knowledgeable about sepsis. The risk for reinfection is high for those hospitalized with sepsis, and therefore, education is crucial for ongoing management of their health and well-being. As we previously mentioned, all facilities may not have the capabilities to implement all the core elements. However, implementing those that are feasible will help to improve the management of sepsis at your respective facilities. As we conclude, here are the key takeaways. Sepsis is a medical emergency that occurs when an infection overwhelms the body's immune responses, damaging cells and organs in the body. One-third of all sepsis survivors have a second hospitalization within 3 months of the initial sepsis illness. Stay ahead of sepsis by preventing infections, practicing good hand hygiene, knowing the signs and symptoms of infections, and acting fast. The main goal of a sepsis program is to improve the treatment and outcomes of patients with sepsis. A simple mnemonic that you can use to help recognize sepsis is time. T stands for temperature, I for infection, M for mental decline, and E for extremely ill. Remember, if you see the signs that you think could be sepsis, notify a healthcare provider immediately and initiate early treatment. We'll now review a scenario to provide room for discussion and implementation of what's been learned in this presentation. In this scenario, you are assisting a patient during breakfast. You notice that even though she usually enjoys eating, she does not have an appetite today. You walk over to ask how she is doing, and you notice that her skin looks sweaty. She tells you that she feels cold. What should you do? While we are not sure what exactly the patient is experiencing, it's important to recognize the difference in this patient's behavior. In sepsis, we need to act fast. A nurse or doctor should be alerted immediately regarding this patient's symptoms. Remember, the early warning signs of sepsis are based on signs and symptoms only. You can keep exploring these topics on your own using the resources on this slide. Project FirstLine has a suite of products to help you learn more about how to recognize infection risks at work, where germs live in healthcare, and how germs spread. You can also follow Project FirstLine on social media. Thank you.